After a diagnosis of a DVT or a PE is made, the initial step in treatment is to start a blood thinner or an anticoagulant. The most common anticoagulant used include heparin in the form of low molecular weight heparin, Xarelto, Eliquis, or Coumadin. The anticoagulants have two major effects. The first is that it prevents the propagation or the growth of the clot, and the second is that it prevents the embolization or the clot breaking loose and going to the lungs. The anticoagulants do not have a direct effect on dissolving the clot. However, it mitigates the clot from getting worse and prevents it from going to the lungs, which clinically stabilizes the patient and enables the medical team to be able to determine what the next step in therapy should be. After stabilizing the patients with anticoagulation, the next step is to determine if patients would benefit from further additional therapies. There are endovascular, minimally invasive procedures that can remove clots from the legs and from the lungs. Patients with a large amount of clot, with severe pain and swelling in their legs, or a large amount of clot with significant heart or lung damage or complications from their PE may be candidates for these endovascular procedures. For the retrieval of a blood clot from a DVT, we can utilize a device called the Inari ClotTriever system. The main advantage of this latest development in clot treatment is that this system removes large clots without relying on using thrombolytic medications, thereby significantly lowering the bleeding risk of the procedure. Its unique design is an over-the-wire system which enables removal of clot burden from the veins. There are two elements to the system: the ClotTriever catheter and the ClotTriever sheath. The catheter features a nitinol coring element and a braided collection bag. The sheath features a self-expanding nitinol funnel at the end of the sheath. Upon obtaining venous access, a guide wire is inserted and guided through the clot. The ClotTriever sheath is inserted over the guide wire and positioned below the clot. The funnel is then deployed to maximize capture of the clot. Next, the ClotTriever sheath is deployed past the clot and positioned for deployment. The catheter is then unsheathed to open the nitinol coring element and collection bag inside the vein. The catheter is then slowly retracted towards the sheath, coring and separating the clot from the vessel wall and capturing it within the collection bag, which prevents the clot from breaking loose and traveling to the lungs. The collection bag is withdrawn into the funnel and collapsed to remove the entire clot out of the sheath. After successful clot retrieval, the sheath is removed and standard vessel closure is performed. For the retrieval of blood clot from a PE in the lung, we utilize a system called the Inari FlowTriever system. This device is specially designed to navigate into the lung vessels to engage, disrupt, and extract blood clots from the lungs. The procedure begins with accessing the patient's vein in the leg, and a guide wire is navigated through the clot in the lung. The FlowTriever catheter is then advanced over the guide wire and positioned just proximal to the clot. Using the large syringe, a negative pressure vacuum is generated and the clot is retrieved through the large bore catheter. If there is residual clot, a catheter with nitinol discs which can engage the clot and liberate it from the vessel wall is utilized. Patients' oxygen levels, blood pressure, and heart function usually dramatically and immediately improve after clot removal from the lungs. The FlowTriever system has enabled us to be able to remove large amounts of blood clots from the lungs without using thrombolytic therapy, thereby decreasing the risk of bleeding. These advances in endovascular therapy have enabled us to take care of these patients without major surgery and oftentimes with minimal anesthesia, enabling the patients to recover quickly and to be able to go home right away.